Good afternoon, everyone, and welcome back to another episode of Facebook Live, our Get Help, Give Help segment that we're doing on Tuesdays. We're so glad you could join us again. We've got a great panel today to talk about childcare, which is a hot topic and timely given that folks are returning back to work. And so we're going to introduce those folks in just a minute. First, just a reminder, if you need help, we're recommending folks go to the City of Columbia webpage and go to our COVID-19 Get Help link. We've got a lot of great resources there, including childcare resources. You can also always contact 211. That's a statewide resource, and folks at 211 are available 24/7 to take your call, to try to refer you to the resources you need. So those are two excellent resources. Also, just a reminder that Como Helps is still collecting donations for our community's response to COVID-19. Again, Como Helps is a partnership between Boone County, the City of Columbia, the Heart of Missouri United Way, the Community Foundation of Missouri, and Veterans United Foundation. To make a donation, just go to comohelps.org. You can give there to either the United Way or the Community Foundation, and those donations will be used in response to the pandemic here in Central Missouri. I want to turn to our excellent panel today. I'm going to introduce our guests. First, we've got Robin Phillips. Robin is the CEO of Childcare Aware of Missouri. We've got Gay Lydikin. Gay is the ED of the Mary Lee Johnston Community Learning Center. And we've got my friend and colleague, Joanne Nelson, who's the director of Boone County Community Services Department. These guys are going to talk a little bit about childcare today. We asked Missouri Department of Social Services if they could join us to talk about state childcare assistance, and unfortunately they couldn't. So I'll talk about that briefly later in the conversation. We've got some different perspectives that we tried to bring. Joanne brings the perspective of a local funder trying to ensure that childcare assistance is available in the community. Robin really brings a statewide perspective of an agency that tries to link folks to childcare and also support childcare providers in our state. And then Gabe brings a on-the-ground perspective of a nonprofit childcare here in our community. So thanks everyone for joining us. And I'm going to start with Joanne Nelson. Joanne, could you talk a little bit about the county's role in childcare in response to the pandemic?
Well, when the pandemic came about, we worked with each organization on reallocating the funds that they currently have. And we've been able to work with two Boone County nonprofit childcare providers to reallocate funds more towards childcare subsidies. We knew families were going to be in trouble when we saw people losing their jobs, people having the stay-at-home order. So we felt like this was real important for the child care subsidy to be there for those families who were newly found themselves in those positions and they were essential workers. The other thing is we allocated some emergency procurement funds to Rainbow House, who was awarded a temporary license, and they are currently taking up to 7 kids at a time for 24 hours a day. And those are for essential workers, hospital employees, nurses, any type of essential employee. My understanding is that they are full, fairly full, and they are working like gangbusters. And we are real excited about being able to offer that service, especially during this time when there are some childcare providers who are currently closed.
Joanne, could you talk about
pretty much what the county's doing? Hmm?
Excellent. Could you talk a little bit about where the funding comes from for the county?
Yeah, the Children's Services Fund is, as a reminder, is a quarter-cent sales tax that was passed in 2012. And we collect those revenues and they are distributed by our 9-member board who allocates the money based on statutorily eligible service areas. So if you are, and we can only award funds to nonprofit agencies as well as governmental agencies. There we're very limited at where the money can be awarded to and who receives those funds.
And just a reminder that if we have nonprofit partners viewing today, just a reminder that if you need support to provide services during the pandemic, just go to comohelps.org and submit a single application. And that application is viewed by all 5 local funders each day. And we've pushed out over $700,000 in local resources in response to the pandemic so far. Joanne, thanks so much. And for our previous years, you know, Joanne and her fabulous staff have been helping us, our department, as we lead the community's response for mass care and human services. So big thanks to our county friends. I'm going to turn to Robin Phillips, the CEO of Child Care Aware of Missouri. Robin, welcome and thanks for joining us. And we're hoping to learn a little bit more about what you guys do and what's going on during the pandemic over at Child Care.
And thank you so much for having me and letting me share some information about who we are and how we've been playing a role. So Child Care Aware of Missouri is a statewide nonprofit organization that is known as the state's child care resource and referral system. And we've been delivering resource referral and training service along with many other types of things to the child care provider community and to families for about 20 years. A big component of what we deliver around resource and referral is helping working families find childcare. And so when we initially went into response mode for pandemic, not even preparation, it just happened so fast. And our organization is based in St. Louis. So it was happening really fast here. And so we developed a map to really for partners and other community stakeholders and decision makers to keep a track on what child care programs were open to assist first responders, medical personnel, and essential workers to find childcare, and had even, plotted the hospitals on that particular map. Now that the governor has, lifted the stay-at-home order and counties are starting to try and get back into a phased reopening process, what we're trying to do now is keep our arms around what supply data is available for childcare. So one of the key things that we were doing every single week was working closely with state licensing to get data from them along with some of the outreach we were doing so we could keep an eye on how many programs were open across the state, how many were closed across the state, who was open to serve just first responders, so on and so forth, so we could keep an eye on those data sets. And as of last week, with the governor's order starting to reopen the state, we're keeping even a closer eye on what's happening with who's starting to reopen. And I think, one of the challenges with that is childcare programs themselves are navigating what steps they need to do to open and operate safely and are looking for guidance and so on and so forth. But nonetheless, none of those programs should be opening at their full capacity. And so it's trying to stay in communication with all the partners that we need to make sure that we are referring families who are looking for childcare to programs who are actually operating and who have the space and availability. So it's going to be an interesting thing to see what happens because none of us have the crystal ball to know what the demand is going to be. We don't know how many people are returning to work. We don't know how many will continue to stay home. We don't know how many will cease childcare for a period of time. So it's a lot to navigate amongst our organization and our childcare educator partners as well, and state departments as well. We have created some consumer education for parents who are looking to go back to work, and maybe, I think choosing childcare at any point in time can be a challenging and stressful decision to make. And then of course you think about this particular situation and what are all those additional questions as a parent or a family member of that child should be asking that care provider about what they're doing for safety precautions, what the family needs to be doing, and what are the expectations of everybody involved. So that information is out and available on our website and on our Facebook page, Child Care Aware of Missouri. And we have also worked with several entities across the state, one out of Kansas City who's taken the lead role on that, but for childcare programs who are looking for guidance on how to reopen, there is about a 25-page manual that will be released later this week that refers to its guidance. So none of us are experts in any of this. It's a guidance manual for child care programs, and a lot of the content relates back to CDC and the American Academy of Pediatrics, as well as some other lessons learned from child care providers that have been in operation during this period of time. And so hopefully that will be something that will give some people a little more peace of mind and things to look back to. And of course, whatever their local public health department is advising as well. Our organization also continues to advocate on the public policy side and continued investment of both state dollars and on the federal level as well, and from the Child Care Development Block Grant and how those monies get pushed into Missouri. So our organization is an advocacy organization as well, and it's a persistent conversation that needs to be had, because there has been a lot of expectations placed on child care providers to step up and serve families of first responders and medical personnel, and there have been absolutely no resources available to them for the increased costs and the loss of income. And they themselves have been serving in a role of an essential worker and are not recognized as such. And those are conversations our organization will continue to push on and fight for, because that's not okay. And with that said, I'll wrap up here. We are a nonprofit organization. We are raising money right now to funnel mini grants to childcare programs across the state. We're currently pushing out some funding from a St. Louis-based foundation who contacted us and wanted to give back, and we are issuing those mini grants as we speak. We already have the mechanism in place to do so. So if any organization or individual is looking to make that donation, they can contact me directly, or they can go to our website, which is mo.childcareaware.org, and the donate tab is at the top. One thing I'll add is if families are looking for childcare, you can do an online search at that same website I just mentioned, mo.childcareaware.org, or you can call 1-866-892-3228.
Great. Robin, thank you so much. You mentioned guidance. Just so folks know, and we'll look forward to seeing the more comprehensive guidance, we did include guidance for child care providers in our business guidance document on the city's website that was released a couple weeks ago. We continue to add and update to that, and we'll look forward to seeing the guidance that Robin mentioned. So we'll try to get that posted as well. Robin, thank you so much. You mentioned the state child care assistance, and I mentioned earlier we tried to have a rep from DSS on, and I don't want to speak for DSS and can't, but I did print off information that we received from their media folks. Basically, due to increase in federal funding from the CARES Act, they have pushed out some additional assistance for childcare, both for families and for providers. And so that information is on their website. It's mydss.mo.gov, or folks can call 855-FSD-INFO. That's 855-FSD-INFO. Again, there are increased benefits for families, increased income guidelines, and there's also some special funding for providers. We won't get into too much detail about that because none of us work for DSS, but we do want folks to know that they are pushing out federal funds they received from the CARES Act. As Robin mentioned, for those of us in the human services business, there's never enough childcare and never enough childcare assistance funding, and we're all trying to navigate that during these interesting times of the pandemic. So, Robin, thank you so much. That was a great overview. We're going to turn to someone on the ground providing childcare, our old friend, Gay Lydikin. Gay, again, is the ED of Mary Lee Johnston Community Learning Center. That name is almost as long as our department's name. And Gay, I want to turn it over to you and again, get your perspective of someone who's on the ground and has continued to provide childcare through the pandemic. Gay, welcome and thank you.
Well, thank you. Thanks for having me. So Mary Lee Johnston Community Learning Center has been in our community since 1934. So we have some strong roots here, and we provide safe, affordable care for children. We base our tuition on family income. So to meet the needs of those working families, we made the decision to stay open because most of our families are essential workers, and they needed that childcare. So we worked at half staff for a while, so that we could really reduce contagion, keep people home for 14 days, make sure nobody was showing any signs of illness, and that would be teachers. And then we eventually came back full staffed. So we are serving, definitely not our capacity here at the center, but we are able to serve everyone that needs childcare at this point. That's a very good thing. I do fear that we will not be able to meet the needs of all of our families when they all return to work. So that's a concern we have. We had excellent sanitation guidelines here prior to the pandemic, but working hand in hand with the health department, that's been very helpful. So we have ramped up sanitation every time the kids go outside. We bleach down the playgrounds, we bleach down the classrooms. It's a continual sanitation process. Social distancing has been difficult, obviously, with children. It's not easy, because the only thing you want to do is just love and hug on those children who have no clue what's going on. They're really confused. They're a little bit frightened. So we social distance as much as we possibly can. We do have parents dropping off their children. So we meet them, an administrator meets them at the car, and we take them to their classrooms. We check temperatures when they come in. We ask parents certain questions. How are they feeling? Have you noticed any changes? We're doing everything we can to prevent people from coming in and out of our center, with the exception of staff and children. Again, we have 3 buildings here, so we have to be very careful about who goes in what building, who comes out of what building. So when we had more staff, that made it a little easier. We could prevent in and out of buildings. It's a process. Parents have had a lot of questions. Fortunately, we've been able to meet the needs so far. We've had help from the United Way and Boone County Community Services, which without that support, we couldn't continue to do what we are doing right now. So it's been a learning process, and I think that we are continually adding procedures and policies because we want to prepare for the future. So if we have another outbreak in the fall, what will we do? What will make this work for families?
Okay, how can folks reach you? And I know that you're a nonprofit and always seeking to raise funds. Can you tell us a little bit about how folks can get help and give help to Mary Lee Johnston?
Certainly. We actually have infant toddler openings right now. So I did want to get that out there. And it is, again, it's a difficult process. We Zoom with first-time families, and we FaceTime with them to give them tours of the center. So kudos to all those new families we have, because that's got to be a heartbreaking process to not physically be in a building that your child's going to be in. But we do have accommodations for tours if you're looking for infant and toddler care. And then we have, as a not-for-profit, we definitely are always looking for funding, but we really are in need of sanitation items. So disinfectant wipes, gloves. We have those things, but not enough. So disinfecting wipes, bleach, gloves, items that are going to help us continue to keep everything sanitary. Those are the items that we really need right now. And you can call our center at 449-5600, or you can go to our website, which is mljclc.org.
Great, Kate, thank you so much. You mentioned a few things I'd like to touch on. If folks need guidance, no matter what type of business you're running, we are offering ongoing guidance and support to businesses and organizations here at the Department of Public Health and Human Services. As Gabe mentioned, we have provided guidance to child care providers on safe operation. If you have questions, just email businessguidance@como.gov. That's businessguidance@como.gov, and one of our team members will get right back with you. Also, I wanted to mention Como Helps is also assisting with supplies. So if we have any providers, nonprofit providers watching, on our comohelps.org website, there's a link to a very simple form to fill out to request some PPE that's pretty tough to get, but disinfectant supplies, and our friends at Veterans United Foundation are funding that effort. So just a reminder there. I want to thank all of our guests for joining us today. This has been incredibly helpful. I know childcare can be stressful for parents in the best of times, and as we navigate this pandemic, it is doubly so. So it's always great to know, and as I always say, we have incredible resources here in Columbia and Boone County, and also some great resources at the state level like Child Care Aware. Again, just a reminder, if you're seeking childcare, you're aware Missouri is just a great one-stop shop to find resources. And that includes not just childcare, but resources about what to look for and how to navigate the system. Big thanks again to Gabe and Mary Lee Johnston, and for keeping up the work through the pandemic. And someone mentioned, and Joanne's heard me say this before, I always think of our human services providers as the forgotten first responders. Many of us have been out there providing services through the pandemic directly to folks. And so big thanks to Gay and her staff. And as always, thanks to my sidekick, Joanne. And appreciate you joining us as always, and our fabulous interpreter, Shelby, who joins us every week, twice a week. Just as a reminder, if you need resources, just go to the city's webpage and click Get Help. We've got a link to Child Care Aware on our Get Help page. We also have a link to 211 and also our Como Resources Guide. And in our Como Resources Guide, we have resources such as Mary Lee Johnston under Child Care and Early Childhood Education. So just a reminder, that's always there. And if you have the wherewithal to help out, we could still use the help. And so you can go to comohelps.org to give help. Easy way to do that, and easy way to support our nonprofit friends in the community. Again, thanks to our guests, and thanks to you, our viewers, for joining us again on another Get Help, Give Help Tuesday. We appreciate it, and we'll see everyone next week, and stay safe. Thank you.